So my name is Dr. John Shepard. I am an ophthalmologist and I am the director of the Weigel Williamson Center for Visual Rehabilitation at the University of Nebraska Medical Center in Omaha, Nebraska.
Welcome. Please tell us about your presentation on helping ophthalmologists assist patients in identifying low vision services.
So as ophthalmologists, our education gears us to be thinking about the eye, how the eye works, how disease impacts it, how our medical and surgical treatments impact the eye. But in the process of doing that, we often overlook what it's like from the patient's perspective. There is someone with those eyes that's trying to use the vision to read, to watch the television, to pay the bills, to see a grandchild's face, to drive. And so in the process of managing the disease, if the ophthalmologist is not careful, they may not manage the impairment that is caused by the disease. So the presentation today is really to get them to think about that. And there is one thing they need to do when they have a person that has chronic irreversible vision loss in their chair in the exam room, and that is to make sure that they ask them if they are having trouble with the vision they have doing the things that they enjoy. And as soon as the patient mentions 1, 2, or 3 things that are difficult for them to do, then the ophthalmologist, what we're trying to do is encourage them to educate their patients on community resources that are in the area. It may be sending them to an ophthalmologist or an optometrist that has a low vision practice where they can specifically address the impairment, or it's getting them in the hands of resources that might help them with different areas of functioning that they have. And then also being able to introduce them to professionals that may be able to assist them.
What kind of resources would you like patients and ophthalmologists to be aware of?
So, as a low vision specialist, when a patient comes to see me for a low vision evaluation, the first thing we do is gather a functional history, where we're trying to understand all the areas of daily living where a person is having challenges and where they would like to do better if possible. So reading, working in the kitchen, driving, watching the television. So we like to get an idea, is it making it difficult for them to do work activities? For students, is it difficult for them to be able to accomplish school tasks? And we also like to get an idea how the individual is adjusting and adapting to that, because depression can sometimes accompany vision loss, and if so, individuals need to recognize the resources where they might be able to get help to manage that. And so a lot of times that might be the primary care doctor, but they may not be aware of that, and so that's where in a low vision exam we can specifically address that. The other thing that can be very, very helpful is all of the wealth of vision enhancement aids that are out there. Various magnifying tools, telescopic lenses to help people with a variety of daily living activities. And there are so many magnification resources out there that it's helpful to know what ones might be applicable to me for the activities that I want to do. Some people that like to read the physical newspaper, it might be a handheld or an illuminated stand magnifier. For other individuals, it may be computer adaptations where they can make fonts larger on the screen. And then there are even tools that can help people when they don't have enough vision for vision enhancement devices, where they can use vision substitution devices that can read things to them. So there's a whole wealth of adaptive equipment that can help. There are also other individuals like occupational therapists that can actually help people to find adaptations, environmental adaptations in the home. So maybe you're struggling in the kitchen and there may be ways to see the appliance styles better or to mark them for safer use of the appliances. There's ways to take advantage of lighting, enhance contrast, minimize safety issues in the home, and sometimes occupational therapists like the ones that work at my center can actually make a home visit and help people to assess those things. There is also visual skills training where some people need to better learn where their best viewing spot is when the central vision is involved from, say, macular degeneration. So there's some eccentric viewing training with how do I line up what I want to see with my vision when the center there is a black spot or a dark area where I can't see so well. So these skills can be taught to help people be more successful with the vision that they have. So these are all the types of resources we want ophthalmologists to know about, so not that they in and of themselves in the course of managing disease will be involved in those things, but that they can refer the patients to individuals like a low vision specialist that can actually address the impairment.
How can ophthalmologists and patients find resources available in their area?
You can either actually Google low vision services and put in your community, and you might see options that come up. The American Academy of Ophthalmology, actually on their website, if you put in low vision resources in the search bar, it will give you an opportunity to find a way that you can actually search in your particular community for what is available. There are things like that can be very, very helpful. Many communities, there are state services for the blind and visually impaired. There are eye doctors that provide these services. So that is the best way to be able to find out those things if you're not actually being referred by an ophthalmologist.
Is there anything you'd like to add in closing?
I largely would just encourage people that if you're struggling with your vision loss from irreversible vision loss from things like macular degeneration or advanced glaucoma, there are resources out there that can help you to function better. So while it's important to have the disease managed to prevent further vision loss, it is also important to try to live and adjust as well as you can with the vision loss, and there are resources out there.